Yeah.
Do some educating with us.
Absolutely. Okay, so I think what we're going to start is just kind of going over. Patty gave me a list of some of the kind of hot things that she wanted me to touch on, and then we're going to do show and tell with a couple, and then if you guys have any questions on things I haven't touched, we can kind of go that route as well. I think the biggest things that Patty mentioned, that the majority of cats here, definitely vaccinations. So even for me, sometimes I find it's a two-person job. One person to hold the cat, the other person to make sure we give the injection, because I've even, in my career, if it goes through and through and everything squirts out the side because they're too squirmy. So having one person to hold the cat, and then also making sure that we draw the vaccine up correctly. So we'll kind of go over that. Another is every now and then there are some cats that are sick, and we'll talk to Patty about, give some subcutaneous fluids. So we'll kind of go over not only administering the fluids, but the first part, if you're that lucky person that the bag is empty and you have to start a new bag, kind of how to get everything all primed and ready to go. And then the last thing I think that was the hot thing you wanted me to talk about was medicating. And I mean, I had a Orangey who was not the nicest cat for about 15 years, so thankfully I never had to give him an oral med. I would have lost a finger, but there are some tricks of the trade having worked with him to kind of little burritos with the towel, and sometimes it's easier just to stick the pill in their mouth real quick than trying to force with liquid and things like that. So we'll kind of go over liquid meds, how to pill, things that work for me, things that work for him, because he does a lot more handling as a technician than I do, so if he has any pointers. And then I know a lot of you have little baby kittens right now, so we'll kind of hit on little hot button things, and then if you have any questions, we can do that as well. So I think, because then we can do Emily and get her done and let her relax again. She's kind of a recent one that does need a vaccine. So kind of going over, basically they come out of the refrigerator, so you don't want to pull them out and get them ready too soon, because if they're in room temperature for, I would say 20 minutes or more, you're kind of denaturing the vaccine. So you don't want to leave it out too long. Yeah, when it gets to room temperature, that's why you keep it in the refrigerator. So certainly kind of make a plan, you can draw it up, have the kitty out, give it, and then you can kind of do other things.
But if I misunderstood what you said. Did you say take it out and do it immediately, or let it sit for 5 minutes?
You can definitely let it warm up a little, but if you're leaving it out, say you're drawing up a bunch of them and then 20 minutes have gone by,
I
there's the
that.
risk that the last one may no longer be as effective. Sometimes it is a little bit startling if they get a really cold vaccine, so there's nothing wrong with kind of doing it
5 or 10 minutes
a
is
minute
okay.
or two. Yeah, so
Dr. Williams, so does that mean if it's no longer effective that it's no good and should be disposed of?
I mean, ideally,
Is that what you're
if
saying?
you find that you got pulled away and 45 minutes went by and you had a vaccine hanging out, I'd probably get a new one. I mean, sometimes with rescues, I get it, you have to kind of, it's our last vaccine, what do we do? But just know that there's a good chance that one's not going to be potentially as effective as the one you just got out of the fridge 5 minutes ago. So just trying to do the best you can and make sure it hasn't sat out for a long time before you use it, if you can. So obviously you want to use a fresh syringe, and you just kind of pop it down to open it. These are nice. They always come with a needle. I always twist it to tighten it because they're what's called lure locks, so they twist on and off. Every once in a while they're a little loose, and the last thing you want to do is when you've injected it, the cat jumps and then they got a needle in there because it popped off. So just twisting it to kind of tighten it is important. The vaccines, these particular ones, they come in 2 different vials. One is just a diluent, so you're going to use it to dissolve the powder of the vaccine. So you take the cap off, and then you have your plunger. And so you want to put the needle into the bottom part, which is kind of rubber. And I usually just hold it straight up and down. He's going to be show and tell. And that is your fluid. So you're going to put it into the rubber part, and then you're going to pull back on the plunger, and you're going to see the water level coming down. At some point, if your needle's in too far, it's going to be above the water, and so you want to pull the needle down as you are, otherwise you're just going to be pulling air. When the bottle is empty, you're good. You have all that sterile water, basically, in the syringe, and then you want to dissolve your powder. That's what's going to make your vaccine. So then you're going to do the same thing, making sure everything is sterile, and put that fluid into the other vial, and it'll suction in there. I mean, you really don't even have to push it. The air will just pull it in, and then you want to kind of roll it. That'll help dissolve everything.
I already have. go ahead.
Yeah.
I have a
Do
question.
you pre-wipe the rubber tops with alcohol swab or
You
anything?
can. I mean, everything comes out of there sterile. So if you're not touching it or licking it or anything like that, you didn't drop it on the floor. Everything, you know, your hands have been washed. It came out of there sterile. So technically, you don't have to. Certainly, if you're concerned or you dropped it, yeah, there's nothing wrong with wiping it with alcohol. So once it's rolled and it's all dissolved, you're gonna draw it up the same way you did when it was just the sterile water. So you can kind of get everything into the syringe.
So when you emptied the liquid in, you
Yeah.
pulled it, is it Joe?
Yeah.
Is it Joe, pulled it back or down far enough that when he pushed it back up, it was not coming out of the needle, it just came up to the top? Is that what you're looking at?
Are you talking about when you pull it out of the water?
Okay, you pulled the liquid out, so now you've got it in the syringe.
In the syringe, correct.
But then I noticed he pushed it back up, the syringe up.
He was pushing air out. Yep.
That's what I mean, so
Yep.
you're pushing the air, it's down far enough that that's the air. When it got
Correct.
to the top, then you put it in.
Yep, and
Yeah.
then when you can put it in the other bottle, it'll suck the fluid in and not just take all
Gotcha.
that air.
Okay.
Yep. And so then once you've drawn all of the vaccine, and that's what he's doing, he just has extra air that he's pulling out to make sure that the bottle's completely empty.
Mm-hmm.
He'll take the bottle off and then he'll push the air out that's still in the syringe until all that's in there. And then you just put the cap on so you don't poke yourself while you're now going to get the cat and do all of that. Okay, so the next part, and it's Emily, right?
No.
I didn't see when she took it out of the fridge.
I
you want a towel or
know. Oh
something?
my goodness. I don't have feel away.
She's not super happy.
You need help?
Yeah.
Usually I'll spray myself or throw a towel. Oh, Joe's gonna.
Good. Yeah, she's okay. She's, I've just got my back to you.
I have the doctor smell on me though, so she knows. She knows something not good is coming here. We'll leave that open for her.
It's just watching.
I know the kitten is all ready.
It's just watching every.
All right. Do you guys have a special spot that you give yours?
I do it in the front right.
Okay, that's what we do. I just want to make sure I wasn't telling them something different. Yeah, we're gonna switch spots. So a lot of times we try to give vaccines, the same vaccine in the same spot. So if they have a reaction or anything like that, we kind of know what vaccine. So we tend to give this vaccine kind of the right front leg. It goes subcutaneous, so it goes under the skin. And what I usually do, I find the easiest, is to kind of tent the skin a little bit because we don't want to give it in the muscle, we don't want to give it in a joint, anything like that. So just by kind of your thumb and index finger, and sometimes I'll use my middle finger too, just kind of pulling up a little triangle of tissue, and that's kind of where you want to give it. So kind of right around that front right leg. Good job, and this is where it helps with two people. One person's kind of holding Kitty.
Emily's going, "What's-"
Hi, sweetheart. All right. So you have your tented, and you're just kind of going, he's just kind of poking or tapping on the other side. Oh, Miss Emily, you got some thick skin. Yes, you do. And I pull, once I'm in the skin, I pull back just a little bit on the plunger. And the reason for that is if you've gone all the way through the skin, you're gonna get air because your needle's out the other side. And every once in a while you poke through a little skin vessel so you'll get some blood. So as long as you don't see anything in the tip of the needle when you pull back, then I just gently give, I'm pushing on the plunger. Oh, and she's all done. I'm gonna let her relax and then I'll kind of talk through that again.
So you pulled it up and you went into that fatty part that you pulled up
It's
and then
this.
lay it down.
So we're gonna do this on the demonstration of the back.
Yeah.
So you're just gonna grab a lot of the skin,
Yeah,
okay? And then you're just gonna take your index finger and make a tent.
into that, okay.
And then this is where you're gonna give it.
Oh, okay, right at the base of the fatty, the skin.
But you are lifting up,
Okay.
so you do wanna give it at that base. If you try to go down, you're gonna hit muscle and the
So
bone.
you're doing that.
Straight across. Yeah.
Straight in.
And in any area. So we're doing the vaccine
So you'll be
right
doing it over here.
front of the leg. When we talk about subcutaneous fluids, yeah, we are doing it right here between the shoulders. And it's the same procedure to inject the needle. And to try to make it positive, you can certainly pet them, you can brush them when you're done, you can give them a little treat. I mean, you guys know these individuals so well, you'll know what makes them happy.
Oh, she's so
You
good.
did so
What does
good.
it feel like when it goes in?
It's a little
You don't
poke.
have a test kitten, rubber kitten that
No.
says ouch.
I was gonna say, it feels a lot better than when we get a tetanus shot, because those go into our muscle.
What I meant is just the feeling like what we feel. Do you feel it kind of go like pop that you're in there?
No.
Or how do you
Oh,
know?
The best way to
You know what I'm
train
talking-
and then feel is actually using an orange. When
Okay,
you
I've
do
heard that before. Get the orange.
when you do insulin for humans, they tell you to do a peach.
peach.
But the skin of an outside cat is a little bit more tougher, so
Yeah,
an
'cause it's
orange would be
outside.
ideal.
Orange, so
Oh,
practice.
okay.
That's a
And
good
then
idea.
and then you would only go into the rind.
Right.
You don't want to go all the way into the fruit
Okay.
because then you've gone too deep. Hypothetically, if we're working on the patient.
Oh, okay.
So you know how I was saying when you're giving the sub Q, you only want to go horizontal and in.
Sure.
If you go down, then you're hitting the orange,
Yeah.
and so you really only want to go into the rind, the skin of the orange, so you'll feel that texture going in, and then the rind itself, once you get underneath the skin of the orange, is a lot softer.
Yeah.
And so you'll have that sensation of being inside the flesh, the skin. So we're going above the muscle, not really into it too much.
And some cats, I mean, she was, I think, 11 years, outdoor barn cat. Some cats are going to have much thicker skin than, say, your, 11-month-old kittens or your 6-month-old kittens. So hers took a little bit longer to even just pop through her skin than those younger kittens will. Now, the younger kittens are going to be wiggling a lot more. So that's going to be the other challenge is, and that's where having that extra person is going to be helpful.
Wow.
So we need oranges here.
Yeah, I know. We didn't think about that, did we?
I want to make sure, so when you
Yes.
put it in there, then you said you pull it out just a hair, just a little bit, just to make sure.
Yep, so I'm not moving the needle at all. Once the needle is poked into her skin, that stays. The syringe stays. I'm just pulling the plunger
Uh-huh.
to make sure that as I'm pulling back, I'm not getting a big pocket of air, because that means, it's hard sometimes. You have that tent of skin, the needle is in there. It could have poked through that whole area of skin and is poking out on the other side, and I can't see
You
it.
can't tell it, so just bring it back.
So just a little bit, just to make sure I'm not getting a bunch of air or anything like that.
The other thing too is you don't want to just go into where the needle is in. Is that showing up? You don't want to go into where just the needle is. You want to actually go all the way into where the hub. This is considered the hub of the needle. This part right here, this plastic part. So you want to go actually all the way into the flesh of the kitten, the cat. And so that way, if it moves, you're not going to have that much, because you're restraining the syringe, the needle, and so you're not going to have that much wiggle room, okay? If you do this, then everything's going to go left and right,
So you go just
all the way
up
in.
against that.
And as Dr. Williams has already stated, she pulls back just a titch to see if there's any blood or air because you went through. You're looking at this part right here, to see where the blood is,
Okay.
okay?
Okay.
It's not going to fill up in here. If you fill it up here, you need to pull out and then put pressure on for at least 30 seconds. God forbid if that happens. So basically, it's just going to be filled up to this area right here, because even if you pull back a little bit, it's going to start filling up, and then that's when you hit a capillary.
Okay.
And you just got to pull back, as she says in her notes, pull back and then reposition.
Okay.
And then that's it.
Okay.
Okay. So, that's pretty deep. That needle's pretty long though, huh?
But when you're going, so you're kind of going horizontal to the skin. So when you have the skin tented, you're going along the plane. You got all that room that it can
Even
go.
with
Okay.
baby kids.
Yeah.
No, I want
What are you looking for?
Yeah, but see, when you're talking about the length of your needle, sorry, Horton, when you're going into your patient, you're literally going right across the body.
Gotcha.
So you're not going down in,
Yeah.
and you're going to hit bone, everything else, and your cat will let you know. He'll be on the roof.
Yeah.
So you're just sliding in, and so you do need to go that length, so you can have the security to inject. Because if you just do this and they wiggle, then they're already off the needle.
And it hurts because then if it's wiggling in there, it's creating all this inflammation. And then when you go to do it again, they're smart. They've
So
learned.
the kitties that are not yelling, that don't even know they got the shot, you're fine, but when they yelp at you, you know, you got into kind of.
Well, that's hard because some cats are just drama. You know,
Oh.
my cat was just
Like
drama.
personality.
Exactly.
Like us, yeah.
So they
Okay.
also know. So they may just make a lot of noise because then they want you to react and they want you to stop. So
Yeah,
as long
that's
as you're
fair.
doing that procedure and it's in there and it's solid, they can cry, they can wiggle a little, just do it.
Okay.
But I mean, you'll know the difference. If they are screaming bloody murder, then yeah, something might be wrong. You know, you want to go high enough on the leg so you're not near the elbow joint or anything like that. But if you stay that horizontal, you're not going to go deep enough to really do any damage. Do you have the fluids and things like that? Because I think it's a good transition from subcutaneous injection for vaccine, which is a kind of around that right front leg, to, as we were showing on Miss Emily, doing subcutaneous fluids. So obviously vaccines are when they're healthy. Subcutaneous fluids would be certain times if they're not eating, they seem a little lethargic. Sometimes they've been vomiting, that stopped, but we just want to kind of get them feeling better. And we'll give Patty kind of amounts and then she passes that on to you. The best and easiest place to give that, as we were showing on Emily, is just right between the shoulder blades, because that's the most extra skin and it's the most extra space, so it can take that amount of fluids. The first thing, and I don't know how frequently you go through the bags of fluids.
Kind of depends on the time of the year.
Okay. How long?
That one we started Friday.
Okay, perfect. And if you don't use it, how long do you go using it? Till it's gone, or?
A month and a half or something
Okay.
like that.
So I would probably do kind of swabbing the end with alcohol and things like that, because you know we're pushing it a little bit longer than, and sometimes you do with rescues. I mean, you don't want to waste materials and things like that, but when it's open for that long and using multiple cats, even though we're changing needles, doing a swab on the end, we'll kind of talk about that to keep things clean. The first is, it sounds like you're probably not going to have to open a fresh new thing very often, but if you had to, the bag comes separately from the tubing. They're in two separate containers, and then the needle. Those are kind of your three parts of giving fluids under the skin. The bag comes in its own plastic pouch that you break open, and the bottom of it has a little tab. So this part where something's poked into it, that's sealed off. The tubing comes all rolled up. This top part has a spike on it. And there's a lock that rolls up and rolls down. So that basically just, when it rolls down and it's locked, that's kind of clamping or pinching off the fluids. That's how it's stopping it. Otherwise, the whole way that it works is gravity. So you have this big giant bag with pressure, and if everything's opened up, it's just gonna, the higher it is, the more it's gonna flow through. So this is really the only, this little lock here is the only thing keeping that fluid from continuing to just flow through the line. So you always wanna make sure the first thing is that it's rolled down or locked off. So if you had to create a new line and bag, you get your bag, you get your line. It comes not with a needle, but a little plastic cap on the end. There'll be a little plastic cap on there. You would take the fluid line with the spike and you push it through the end of the bag. That's how you're kind of starting initially, and you see how it's kind of a bulb. So then when you tip the bag upside down, that's where the fluid's flowing into. You just squeeze that bulb to fill it, usually about halfway. That again is just helping with suction and with gravity. We're making sure everyone can see.
Joe.
He's my good remembrance that there's a camera there too. The other part, so usually I'll tell Patty, give 100 mils or give 50 mils. So you can see on the bag that there are lines and numbers on the side. Each bag, when it's full, is 1,000 milliliters or 1 liter. So average kind of 10-pound cat, we're usually recommending about 100 mils, maybe at most 150. And so you can use these marks. Right now, the bag is at 500, so it still has 500 mils in it. So if we wanted to give a cat 100 mils, we would go from where it is right now at the 5, and we would let the fluids drop down until the 6. So then the next part, say that this line was hanging on this fluid hook right here, and we wanted to give Emily, because she wasn't feeling well, 100 mils of fluids. The injection is similar to what we just did for her vaccine, except the location is different. We're going to give it in between her shoulder blades. We're going to tent the skin just like he showed in that particular area, and the needle size will be bigger as well, because we want the fluids to flow a lot more quickly. So for a vaccine, typically the syringe comes with a needle. It's called gauges. It's a 22 gauge needle. On the paperwork I gave you, typically for giving fluids, we want to use, this one is an 18 gauge, so the smaller the number, the bigger the needle. I know, it's it's a little confusing.
Yeah, that's the way sewing machine.
Oh, perfect.
If you sew, yeah.
Yeah. So the 18 gauge, it's a bigger bore, so more fluids are going to go through, and that's what you want to use for your subcutaneous fluids, because it's going to go more quickly, it's going to be less stressful for the cat. For the vaccine, you're giving such a teeny tiny, we're giving a mil of fluid versus 100 mils. So that, and you're pushing it in, that can be a smaller needle, and we can give that vaccine no problem. But for subcutaneous fluids, typically it's an 18 gauge needle. I also have in the paperwork sometimes a 20 for those little kittens and things like that. Sometimes the 18 gauge is a little too big, but a 20 gauge is still bigger, and it'll still have it flow faster. So again, as Joe was kind of going over with Emily out here, when you tent the skin and the needle is going in the back of that tented area and kind of horizontal to her body plane, and then the needle stays in, everything is still locked. The fluids are not open or anything like that when the needle's applied. Once she's steady, so you've got someone kind of holding the patient and the needle is in there, the most important is if the bag is laying on the table and you have the patient here with the needle in, you're not going to really get much flow. So you want to make sure, they usually say about 3 feet, which is why they have this kind of fluid bag here, which is great. Sometimes I've seen people use a hanger and a door frame and things like that. Others, if you want to work out your arm for a little bit, you can just kind of hold it up. And gravity will allow it to flow once you open the lock. And you don't do that until the needle's already in the patient. And then the other is, because it'll flow pretty fast, is just making sure you keep an eye on the bag. So if we're doing 100 and we're getting a little below, you want to make sure you stop it, because it's very easy if you kind of forget and you get talking or something like that for this to go and you've given 200 mils as opposed to just 100 mils.
Would they just pee it out?
Most of the time, if you go half a bag, we get a little worried. So you really want to kind of stay within that, especially if they have a heart murmur or something like that. Extra fluids sometimes are not as great. A little extra, if you gave 50 extra mils, I wouldn't be too concerned. But I have seen someone give half a bag before by accident. So just kind of remember to keep an eye on that.
How long does it take for this whole thing to take place?
How long would you say for 100 mils in a cat?
Probably about, depending on the dehydration of the patient, it could almost be like 5 minutes, 10 minutes, anything that beyond that.
It's not a long period of time then.
No, not at all.
It's not like dialysis or anything like that where you have to sit there for a long time or
So
anything.
the fluid is coming out fairly fast.
Yeah. When everything is done and your 100 mils is gone, you're going to see, some patients, you'll see a little fluid bubble that kind of forms under the skin. That's what you want to see. That tells us that those fluids are in there, and they'll absorb over the next, usually 4 to 6 hours. If patients are really dehydrated, they might be gone in an hour. So when you're done and you've decided, okay, I need to take the needle out, we're all good, patient can go back in their cage, you want to relock the fluids, and then the patient still has the needle in. So what I do is I kind of put my hand over their skin area and the needle's in there still, and then I pull out and just kind of, in essence, you're kind of plugging. You're not really, but you're putting a little pressure where you just took the needle out. Sometimes you can use a piece of gauze, a piece of cotton ball. They might leak a few drops here or there, or if as the needle went in, you did get a capillary in the skin, you might notice there's a few pink drops. You're not going to cause significant hemorrhage or anything like that by doing that, but just kind of putting a little pressure, and that'll stop after 5 or 10 seconds or
So you put the needle in,
Mm-hmm.
then you roll that, do you roll it way up to the top?
Yep, you want it completely open.
Open, okay.
And you'll
then-
kind of feel, when you're rolling it down, you feel it pushing on that fluid line.
Okay,
And it's only when it's completely at the top that you can then move that fluid line.
okay. And then when it's getting close to the 50 mil or the 100 mil, then you start taking it down because you don't want to go past it. Or you wait till it gets there.
I would say wait till it gets there
And then
and then just lock it.
Okay.
Just as soon as you lock it, within seconds,
And
it's
you do
done.
it fast, okay, all right.
Yeah. Sometimes you'll be doing it, everything's going great, and then the cat kind of moves, and you'll notice that you're not getting a nice line of fluids anymore. Or it went from a run of, look like someone turns the faucet on, you'll have a kind of a straight line of fluids, and all of a sudden it's just kind of dripping, and you don't think, gosh, the needle's still in there, nothing has changed. And sometimes what happens is the needle pushed up against something inside the tissue.
Okay.
And so you don't want to take it out and then poke again if you don't have to. So typically what we'll do is when someone's holding the cat, you can just take the needle and just gently just kind of move it side to side in when it's still inside, or gently up and down. Again, we're not going like this, and we're not shoving and moving because we don't want to push it into tissue where it shouldn't be. But if it's in the skin like this, then just moving it like that or moving it like that usually is enough to kind of get things flowing again.
Okay, thank you.
Yeah, I think that's. Anybody have any questions on vaccines, sub-Q fluids? The hard part, and I can tell you, we do every now and then have owners that do this in their cats for kidney failure or their dogs. The scariest part is the first time. And then each time you do it, it gets less and less scary, and then you're a pro and you'll start showing other people how to do it.
If you have a cat that seems to be really dehydrated and you've done the fluids and it absorbs within that hour, do you ever do fluids a second time in a day?
I would say if they've been to the doctor and we've kind of assessed, then yeah. It really kind of depends on if they don't have a heart murmur or anything else. Because some patients, they can't tolerate the fluids, even though they want the fluids, so you have to kind of build it up and things like that. So I think if it's a discussion that either you've had with us or with Dr. Nolasco, absolutely. But it's kind of on a case-by-case basis. But there are some that you'll say, well, I don't even see the fluid, but where did it go? They just absorbed it so quickly because they just needed it. And then there are some that are kind of chunkier, where you're not going to feel the fluid bleb because it's just going to go in and mesh with all of their extra tissue that they have.
Have you ever seen the fluid move down into the neck?
That's a great question.
Form of
You know what? I've never seen it move there, although it's certainly possible. I have seen it move down the side or sometimes down the arm. I've seen some dogs, especially, who would get kind of a fat arm. Typically, they've got enough subcutaneous space, which is where we're putting the fluids. It'll absorb. It might feel a little weird. It doesn't hurt them. Usually 100 mils, their body, wherever the gravity decides to send it, it'll absorb typically within that 4, 6, at most kind of 8 hours. But yeah, that's a good point. Sometimes it can move to places. So don't think that you did anything wrong if you put the needle in between the shoulder blades and an hour, 2 hours later, they get a kind of a swollen armpit or something like that. It just means gravity kind of worked against you a little bit, but it'll absorb no
Would you
problem.
ask that? I would freak if I saw you.
Yeah.
I called the vet and said, what happened? She's got a goiter or something. It's all right in here.
And then it absorbs, yep.
It'll be absorbed.
Yeah. And then the most important is you always want to, for the new patients, change needle. You always want a brand new needle. 1, for sterility. 2, they get dull. So you don't want to be using a dull needle on the next patient, because then it can start to hurt. And because the line is potentially sometimes there for a couple of weeks, I think between taking the needle off and putting a new one on, it wouldn't be wrong to kind of swab with a little alcohol,
Sure.
just to kind of help keep things nice and sterile.
Yeah.
Back in the day, we used to, swab the skin or the hair with alcohol too. They've really kind of found that you don't need to do that. If everything else is sterile, then, certainly if they just rolled around in dirt or something like that, absolutely. But these guys are usually pretty clean, so. Anybody have questions on vaccines or subcutaneous fluids?
Not till we have to do it.
Yep, exactly.
Exactly. Are you gonna come stand beside us?
Well, most of you have enough kittens coming up, you can do
There you
auto
go.
practice.
Oh, I know.
Well, and if you can do it on a kitten, you can do it on, because kittens are definitely, they're gonna cry a lot more, which is stressful, and they move around a lot more.
I plan on doing it on this litter. They're gonna be healthy.
Yeah, there you go. I think the other thing that Patty,
You still need the
Oh, I know.
vaccines though.
That's true.
yeah, there you go, that's good practice.
Oh, yeah, that would be the 3 shot, okay.
I think the next
I
thing
got 18
that
shots.
Patty wanted us to kind of talk about was giving medications, because I am sure that there's lots of cats that go through that are on different medications. And with cats, some medications can only be administered as a liquid. Other medications only come in a pill. There's a few that have now come out as what's called transdermal, which I actually don't have on here, but the ones where you can wipe it on the inside of the ear. So
That'd be nice.
I know. If all of them could come in that way, that'd be great. But right now, there's only a few that are effective that way. I think they just came out with an appetite stimulant where you can actually rub it on the ear. So Paws might start using that a little more frequently. So as far as giving medications, where's the little Horton?
Oh, Horton.
Yeah, the elephant. I don't want to stress Emily out. So you probably do this more than I do, actually. What I found, as I said, I had an Orangie who probably bit me at least 3 times in his 15 plus years. Doing things quickly was the easiest with him because he was a feisty one. And so sometimes I think a lot of clients think that a liquid is going to be easier because you can syringe and things like that. But most of the time, because it takes longer to administer, it actually sometimes can be a little more stressful. With a pill, you can most of the time just kind of one and done. It's all just not being scared. And that took me a while too. I didn't grow up with cats. So getting to learn that, okay, you're not as scary as your teeth and your hissing and your growling and your pawing and swatting at me are showing. So again, sometimes for those really feisty cats, having an extra person to hold. Other times, if they're not too bad or you feel that you really, you know the cat, you got a good rapport, you can, it's all about kind of stabilizing the cat. I find that using my non-dominant hand to kind of hold the cat and hold their head, and then my dominant hand has the pill, and I don't know if we have any kitties that would make it easy. The kitten.
Callie, you can probably,
Play with her.
Callie should do fine.
Hi, kitty kitty.
She may be a little more.
You've been waiting. Come here. Oh, I think I will.
Too bad Butter's not here. That's the perfect orange wildcat.
Yeah.
Oh, yeah. Yeah.
Look at this. Oh my God.
Needs a bit of purr machine.
Oh, he's just a darling.
That's your dog.
Yes.
Hi. Hi. Yes.
Attached to that one.
Real fast.
Hello. Yeah.
Oh, posing.
She's out on the camera.
All right. So you want to open their mouth and putting pressure on either side of the jaw. Yeah, I know. And once I get their mouth open, I know. We're going to do it again. Yes, we are. We're going to do it again. Okay, I know. And see how I'm pushing her against me so she can wiggle into me? Then I just put the pill in. So
Does the side or?
I go right into, yep, so when the mouth is open, I take the pill and I go as far back in there as I can.
Oh.
That was some swear words. And then I will close their mouth because their first inclination is going to be I want to spit it out at you. And you can either stroke their neck.
Lift.
Oh, sweetie, okay.
Sometimes you can even do a little, come here, sweetheart. Come here. I know, I woke you up for this. A little, just a gentle little blow in their face and it makes them swallow. Or just kind of rubbing rubbing their neck a little bit as well. And then when you're all done, you get some lovin's because you did so good. But the trickiest part is when they're moving around, is just, sometimes I'll kind of hold them under my arm, so that if they wiggle or they squirm, they're kind of squirming against me. And it's that initial, I know.
Getting it
I
open.
know.
Yeah.
And it's just a little pressure. Think of either the upper and the lower part of their mouth when it comes together as the hinge. And if you just put a little pressure, kind of like those change purses that you push on either side and it kind of pops open. You did very good, thank you.
When I was giving medications to cats, I found that if I put a little olive oil or corn oil, just on the tip that was going in, I dip it real quick and it would, sometimes it would slide easier.
think some people-
Sometimes it gets stuck.
I think some people have said like a little butter or something. You have to be careful
Greasy, yeah.
not too much because we don't want it to then cause diarrhea or anything like that. But yeah. Yeah, or if they
It's a good idea.
if they like a little tuna juice or something like that. Again, sometimes finding what that cat likes, but everything in moderation is just a teeny tiny amount. Most of the time, these guys, it's going to be a quarter of a tablet or a half a tablet. So it's such a tiny amount. Do you guys have pill guns here?
I did.
Okay. It's been pretty uncommon now for me to actually see them. Back in the day, they were these
I just
long.
didn't find it any easier.
Yeah.
Yeah.
So it's really
And
just.
I haven't found that the pill pockets seem to work for cats.
Yeah, I was gonna say it's pretty
They work with
uncommon.
dogs.
Yeah.
Dogs, yeah.
Cats, it's usually just okay. You have to, we're gonna do this, and you just pop it in there. They swallow it, and you're good. But I would say kind of hang around for a good 30 seconds to a minute to make sure they didn't spit it back out.
Yeah.
Because every once in a while they will, and then you just gotta do it one more time. And then just stroke their neck, or you can even just kind of a quick little gentle blow in the face, and it'll get them to swallow. For liquid, it's a whole different. And unfortunately, some medications do can only be administered as liquid. So for that, again, I'll kind of hold them. You can kind of steady the head like I was doing, but you don't have to open the mouth. There's a space behind, so they're canines or the fang teeth, and there's a space just behind them. That's where you can just kind of put the oral syringe. And the oral syringes obviously have a different top. It's not the twisty part because we're not putting a needle or anything on there. And that's the part that you can put just behind the canine in that space before the rest of the teeth. And say you're giving half a syringe full of liquid, I usually don't put it in there and then squeeze everything because they're gonna spit half of it back out at you. So it does take a little bit longer. I would maybe give a third, let them swallow, give another third, let them swallow, pet them, you're doing great, things like that, and then give the other. So that takes a lot longer when you're doing liquid, and it's gonna be a lot messier. And if they spit some out, don't give more, just give the dose that they're supposed to get, and then you wait till the next time.
Hi.
Yes, thank you.
That's what I always seem to have.
So the same thing, oh Kitty, you're not done. Oh my goodness.
I haven't done the eye meds on Emily yet.
Hi.
Oh.
You want a demonstration?
Yeah, why not Emily?
Poor Emily, you seem so stressed out. Huh?
Unlike you. You're ready to play again.
Oh, yes. So the same thing is parting.
Of course, that table's slick.
Yeah.
I know. Oh my goodness. So basically what I do is I use my thumb and my index finger and I part the upper and the lower lid just so I can kind of keep it as open as possible. Most of the time you guys are doing an ointment. And so then once they're open, I do that with my non-dominant hand, then I'll take the ointment in my other hand. Come here. Oh my goodness. I know. Oh yes, there you
I'm in a hard
go.
time to get.
Yes.
And then finding that tech.
So basically what I'll do is I'll kind of go, I'll open the top and the lower lid, and then take the ointment and kind of squeezing whichever side is easiest for you from one side to the other. As you're squeezing the tube, a ribbon is coming out, and that's what you want to kind of lay on top of the eye. Obviously, we don't want to touch the tip of the ointment to the eye. Once you have a nice ribbon kind of going across the eye, I'll just make them blink once, and that'll help coat the eye.
You don't put it on your finger and do it.
I don't, because it's not really sterile,
Okay.
and a lot of
Well, if you're
times.
Poke or something.
And
with
that's
that.
the hard
That's
part,
the
especially
scary
with these
part.
little kittens, is
Yeah.
sometimes it is not the easiest. Sometimes what I would offer, because you could see that she's kind of squirmy and scratchy and things like that, a towel can really be your friend when you're doing this by yourself. Do the little kitty burrito. Do you have a towel? We can kind of do a show and
Actually,
tell.
we've got in, one of those things underneath.
Yeah.
There are little pouches.
Oh, perfect.
The other thing too is, if you just scruff them, especially with kittens,
Yeah.
you already spread the eye open enough,
Oh.
and then you can tilt the head back, and then use your other hand to give the medication, and then verse it. And because kittens tend to freeze up, like they're getting lifted by their mother, just trip the eye back and give it again. That's why she pays me the big bucks.
Yeah.
That's right. That's right. Not so much for the adult cats. Sometimes scruffing, if they're otherwise very mellow, can kind of make them a little stressed out. Oh, yes.
There you go.
So the goal of that, if you're by yourself, so if you don't have the little pouch, you take the towel and you kind of wrap them like a burrito all the way up to the neck, so that, as you can see, she can't swat, she can't scratch, and then you've got like a little football of a kitty. But it frees you up then to be able to use your two hands to do those different things as well.
Okay.
Enough is enough, she said, yeah.
You're doing good. Oh, come here. Come here. Oh my goodness. Yes. Is that better? Yeah.
Yes. Oh, we feel sorry for you. Yes, we do. Is that what you're looking for? Sympathy?
Is that better?
Yes, a little sympathy.
All's forgiven. Everything else I kind of included on there was just some things. I know a lot of you are raising kittens and things like that, and I think all of you are doing this, is just kind of making sure that you're weighing them, making sure that they're growing. When they're younger, making sure they have nice warm environments, and as they get older, they can kind of regulate on their own. If you're able to, I think I heard you say one of the moms is pretty feral, but if you're able to, making sure that while they're nursing, that mom's making milk from each mammary gland and things like that, because sometimes if mom no longer has any milk, it's another sign we have to start nursing for them and things like that. Do you get the bottles, do they get the bottles here, or do you guys buy those? Okay, perfect.
And we've used, actually, on our kittens, started using the syringes more
Okay.
with the miracle nipples,
Oh, great, yeah.
because it's a lot easier to gauge how much is actually going in.
That's perfect. And then, stimulating for them after they eat. Usually the first 3 to 4 weeks, and they should be doing that on their own. Oh my goodness. Get it. Yes. Oh, you're such a tough one. And then I think the other most important, especially if every once in a while, if there's a run of upper respiratory or ringworm, is just washing hands between patients. If you're here, and especially if you have a bunch of kittens at home, maybe bring in an extra set of clothes so that you change before you get home, things like that. You do the best you can, nothing's 100%, but to try to minimize
Take your shoes
contamination. Take your shoes off, exactly. Have your Paws outfit versus your home outfit. Yeah.
off. Okay.
I think that's everything that, does anybody have any questions?
Well,
It's very nice.
with me having a feral mama that
Yeah.
came yesterday morning, she doesn't seem to have milk, so I'm doing the feeding still.
It's a lot of work.
But it's an adjustment period, it's only been 24 hours, but I'm finding, before I was regular doing every 3 hours, because they're only about 2 weeks old.
Yep.
But what I have to do is wait for them to come to the front of the enclosure for me to get them, since she's feral and I can't get them. So I'm waiting every 4 hours in order for them to be
Right.
really hungry. That doesn't really make that much difference. I mean, you're getting the food an hour, hour and a half off isn't,
I mean, are they crying like they're starving
well,
between feedings?
they're not crying between feedings until I come up to their cage and start talking to them. Then they come
Okay.
and start crying and come.
And then
they bonded with me enough that
Yeah.
they're coming to me.
So I mean,
So I can feed
cats
them.
are pretty smart. If they're getting hungry, a lot of times they'll start talking. The
Yeah.
other, watching their weights is really
Yeah, they're
helpful.
doing that, yeah.
They
Okay.
should be gaining, and I put some information in here about
How
kind
much
of
each
roughly
day.
how much and
Okay.
things like that. You can use little mailing scales and things because they're so tiny. It's going to be in grams and ounces and things like that. And if you're noticing, it's nice too because you might have a litter of 5 and 4 doing great, and all of a sudden you consistently are having
One
one that
drops
keeps
off.
losing, and that could be the runt. And so you want to kind of focus on that one a little more too, to make sure that one maybe gets fed first all the time and things like
Give it a little
that.
bit more each day.
But yeah, I mean, if they're not losing and they're
Like I said,
gaining
it's been
weight.
24 hours that we've been doing this.
Yeah.
Up until then, it was very regimented, but now that Mama's back,
and they're how old roughly?
they're about 2 weeks old.
Okay.
Their weights are going from 1.19 to 1.09.
Okay.
That's they're
That's
in there.
pretty big,
It's
isn't
a
it?
range
For
of
two
6.
acres.
Well, yeah, maybe they're older too.
Yeah, I think they're gonna be a
older,
little older than that because the one
They're
walked
older.
over to the dish of baby cat yesterday.
too. Yeah,
Oh.
that's what they're.
And
Yeah.
actually took some baby
I mean, we
cat.
could be like almost 4 weeks then.
Yeah.
Yeah. So that's probably why they don't need to eat as frequently.
Oh,
Yeah.
okay.
Yeah.
Okay.
So you're probably gonna get to start already getting them to do some gruel.
They are, this morning, one of them
Yeah.
went over to the dry food and started.
Start mixing it with the
Some gruel.
KMR
Oh,
and
okay.
give them some gruel, and they
Oh,
might
okay.
start going to that, and you can start weaning. Usually, you can start the weaning process around kind of that 4.5, sometimes
Okay,
even
see,
as
I thought
early
they
as
were only
4.
about 2.5 weeks, so, okay.
Are
I
they,
could tell they were.
how, what, are their ears still
No, they
like
were.
airplane ears, you know, like wings of an
When did their
airplane?
eyes open? That's another good
When
Their
way.
I
eyes
got-
were open when we got them.
Okay.
Two of
No,
them still
two
had,
were not.
yeah, two of them
Okay.
still had an eye closed.
Okay. And that was just a day ago.
That was last Tuesday,
Yeah.
Okay. And then they
So,
opened
we-
last Tuesday.
and then they opened about Thursday or Friday.
Okay.
They were all totally open
Okay.
by Thursday or Friday.
Okay. Yeah. Usually 2.5 weeks they should be open. So those might be the late bloomers, but
Yeah.
maybe you have kind of 3.5 to almost
Okay.
4 weeks.
Oh, okay, okay.
Yeah.
So for 4 hours is not a big deal?
Mm-mm.
Okay,
No.
all right. I was a little concerned, but I'm just trying, like I said,
Right.
they have to come to the front of the cage for me in order for
And
me
then I
to
think
get 'em
you're
out.
just watching your weights too.
Yeah.
If you're not getting losing and they all seem to still be active, and
Yeah.
it might be it's for some of those putting out the gruel and seeing.
Okay. Okay, yeah, because they're going to the kibble, the dry
Yeah.
kibble.
You got overachievers.
Let's keep it that
And
way.
mommy has no milk?
And Mommy has no milk, she doesn't seem to have any milk, but boy, they sure love cuddling with her.
They do.
No,
They just,
that's
it's
good.
wonderful, they love cuddling, but she doesn't, she hisses at me, so I can't get
Is she
too close to
cleaning
her.
them? Is she being,
That I'm not, I know,
No.
I'm stimulating them
Mhm.
just because I don't know how much she's gonna be cleaning them.
but she's not rejecting them?
She's
and
not
hissing
rejecting
or
them,
anything
they're
like
all,
that?
they're just,
The cuddling
yeah,
is
they're
there.
cuddling, the cuddling's wonderful.
So they were apart, what, 6 days?
5
5
days,
days.
5 days, 5 days, yeah, yeah.
Now, we're starting our vaccines on our kittens at around 8 weeks.
Mm-hmm.
I've read in some places that we could do it at 6. Do you have a recommendation on that?
You can. I think the recommendation is it's all about when you finish them. So if you do it at 6 weeks and you're doing it kind of even every 3 to 4, you might have to do a 4th instead of just 3. That's the hardest part. And the whole point is it's when does the mother's immunity run out? And that's why we give so many, because we don't know for every cat. It could stay up until 16 to 18 weeks, in which case that's going to interfere with the vaccines. So if you stop giving it too soon and they still just have the mother's immunity, then it kind of renders the vaccine non-functional, and then we stop vaccinating, mother's immunity's gone, and then the kitten has nothing.
So are we better to stick with 8, 12, and 16? Or
I think if you don't want to get in the situation of possibly having to do yet a 4th vaccine, probably makes it easier on you. Because, we do have some that'll come in at 6 weeks and we'll start them, but we want to make sure that that last one is kind of being received within that 16 to 18 weeks. So by starting them at 8 weeks and doing 8, 12, 16, you're good. If you start them at 6 and you're doing 6, 10, 14, you got to do one more to make sure, because it could potentially, they still have that immunity from their moms until 16 to 18 weeks.
And did you get a chance to check to see if we can safely do FDRCPs on nursing homes?
I did not. I apologize. I think there's the note to myself in my
Okay.
office, but I will take a look and kind of find out for you. I'm sure it's going to be one of those. Some say yes, some say no, but I'll go to the sources that I trust and then let you know.
Okay.
Absolutely.
Oh, I have a question here.
Yeah.
And I don't remember who forwarded the name, but I've talked to this lady twice. She's interested in an orange kitten.
Mm-hmm.
Okay,
Yeah,
right?
yeah,
Jan
yeah, I talked
is
to
her name, anyway. But the thing is, she does not want the cat neutered
Excellent.
until 6 months.
6
And I
months.
said that was definitely Patty's, I couldn't make that decision.
Mhm.
She's mentioned that twice
She
to me.
had a reason
And her
for it.
reason was that what, the cat was more docile and more gentle and everything.
Her reasoning
She had
was,
read something on that.
she
line,
got this
was it?
from the University of Colorado, and she
Something.
is apparently real big into all of this.
Yeah.
And her email even indicates, her email address.
Oh.
And that if the male stays unneutered until 6 months,
Yeah.
that they develop better, they're healthier. If the testosterone
I think
stays
the
with
hard
them
part-
until 6 months, she's a firm believer on it.
I mean, I think the hard part in what you can explain to her is there are different recommendations for puppies and kittens from the shelter and humane society. I mean, there's a whole different
Oh, yeah.
field of shelter medicine versus kind of owned patients and things like that. So the hard part is when you're dealing with such numbers of puppies and kittens at shelters and things like that, to be able to get them adopted and things, they do recommend spays and neuters at a much younger age, and so that they can get homes and things like that. For owned patients, we do a lot of times neuter them around 5 or 6 months of age. I don't think right now the studies have confirmed that there's a detriment to doing it younger by any means, but they definitely have shown that if they're not spayed and neutered younger from shelters, they can't get adopted. So her adopting a shelter patient may just not be the fit for her. But I think right now that all the experts are saying when it comes to shelter animals, they have to be spayed and neutered younger. And there's certainly no studies right now that have said that it's doing any harm to them. Beyond that, if that's not something she's okay with, then I would just let her know that unfortunately your kittens are just not going to be the right fit for her.
Well, I've told her that we spay and neuter it for you, she's been really adamant. and I
Is
said,
it
"That's
law?
fine."
It is law in certain states, isn't it?
I don't know about in Arizona. Everything is so kind of individual, but I do know that there is a whole different field for shelter medicine, and it's a specialty and things like that. And it is done a lot younger, but I have not seen or read any studies that have said that that's harmful. Now, when it comes to dogs, that's kind of different with certain breeds and things like that, but it's also few and far between, even for large breed
We have male
dogs.
kittens spraying around here, and we've had females
See-
pregnant by the time they were 8 months.
Exactly.
That was
Yeah.
my thought, and even though she wanted to adopt when they were old enough and had their shots, and then she would go ahead and have the cat neutered at 6 months. You know, she would take care of all of that. We didn't think Patty was.
And there's plenty of
gonna go
other
for it.
shelters she can go to.
Yeah.
Right.
I mean, that's what I would say is it's just this isn't the right fit for her.
But the spraying though, and getting into that habit, because once they start to
Yeah.
learn,
Absolutely.
You can't stop them.
Exactly.
even after they're fixed, they're going to keep doing it.
Exactly. And it's all about the quality of life of the cat. And if the
Yeah.
cat's not going to have a stable home, then that's not a good quality of life. Absolutely.
Yeah.
Yeah. I mean, as a clinician, if I saw that there was a detriment, then certainly, but right now there's not. And I follow the recommendations of shelter medicine veterinarians because, I mean, that's their specialty. They get some even get masters in it and things like that. It's a whole field. So certainly there are things that are being done to determine what's safe and what's not and what's appropriate to make sure they get the best home they can.
And now that we have 29 kittens all
Yeah.
born within about 2 weeks of each other, we'll be
Exactly.
keeping you busy within a couple
Yeah.
months.
Exactly. Exactly.
You know, the other thing these people could be told is that you never know when you're sexually active. I had 2 kittens at home, they were having sex all day long, I didn't know it. And she crawled under the couch and she gave birth to just a little puddle of stuff.
Yeah.
She was small,
Hmm.
and so was he.
Yeah.
And you just don't know.
Are you talking like what, 4 months or something? 4 or 5 months?
Well, this has been about 25 years ago.
Oh,
now,
okay.
But they were small.
Yeah.
Yeah, but cinnamon came into heat.
Yeah.
at,
And they did not do them
4
early on.
months.
4 months.
Yeah.
Yeah,
Well, and we just did
In
the
my
surgery
last
on
year.
ash, and ash was in heat.
yeah,
Yeah.
that's true.
And,
But that was
Ash was 6
long after
months.
cinnamon though.
and cinnamon was 4, because remember Dr. Williams said, well, what got in there? What was it that was swollen? Would that be I remember you did her
Was it the
spay,
uterus?
the uterus was swollen.
Oh,
or
yes,
something.
yes, yes, because she
And they
was
called me
in,
and I
yeah.
said, oh, well, she actually was in heat about a week or 2
Yeah.
Mm-hmm.
and she was
4
only
months?
4 months old.
Yeah.
Yeah, oh, she had her, cause
It
I
was
was
that
over there
big.
that day and I
Oh,
said,
Yeah.
well, she's in heat,
Yeah.
she's only 4 months,
I
she
know, we
had her,
could
you
tell.
know, the rear was up,
Mhm.
she was cooling and
And she had one
fine, and-
brother, thank goodness he was not interested in what to do.
Yeah, that was her first thought.
Thank you.